All right, I think we can go ahead and start. So welcome again to Dakar Frontier in Pharmaceutical webinar, Brazil Digital Stakeholder Engagement Strategies. My name is Renata Buji, and I'm a Client Services Manager for the Americas at Dakar Frontier. This webinar is co-hosted by Dakar Frontier and Pharmaceutical. And before we start, I wanted to quickly take 2 minutes just for an overview of both companies. As some of you might already know, Dakar Frontier is a global market intelligence and consulting firm, and we have tailored solutions to drive growth for clients across the B2B, healthcare, consumer, and the technology sectors. Our dedicated team serves as advisors to our clients by delivering the market and industry knowledge they need to succeed at all different parts of the business cycle. Our ongoing research, paired with custom solutions and our transaction support services, provide clients with timely and actionable insights so they can adapt and win in evolving markets. Our company is headquartered in Washington, D.C., with offices in Troy, Michigan, New York, London, Paris, Berlin, Singapore, Shanghai, and Bangalore. For more information, just visit dakarfrontier.com. And co-hosting this webinar with us, it is my pleasure to introduce you to Farmaceto. They represent the Brazilian medical community before the pharmaceutical industry. Through constant telephone contacts, Farmaceto keeps the profile of more than 400,000 doctors and healthcare institutions properly updated for better communication between laboratories and doctors. So they improve not only the quality, but also the quantity of this information. To learn more, visit farmacerto.com.br. And finally, during today's webinar, we will have the chance to review new data from healthcare providers in Brazil regarding not only their experience during the pandemic with digital content from the industry, and also the expectations for telehealth after the pandemic. This session was designed to uncover how virtual engagement will evolve and the implications for customer engagement models, and also strategic implications for telehealth in Brazil. So with that very brief overview, it is now my pleasure to introduce you to our presenters. We have Alec Lee, our Director for the Healthcare Practice for Latin America at Dakar Frontier, Fabrice Saylor, founder of Farmacerto, and also Bruno Triascher, in charge of innovation at Farmacerto. So now I pass the word to Alec. Alec, the floor is all yours.
Perfect. Thank you very much, Renata.
Of course.
Let's go ahead and get started with today's chat. I just wanted to pause here for a second. So we're going to be speaking specifically about the impact of the pandemic on digital stakeholder engagement within Brazil's healthcare system, and attempting to look forward to 2021 regarding what are going to be the impacts, the lasting impacts, better said. There's going to be about 3 to 4 live polling questions that we'll do after a couple of the discussions around key topics. The group on the line, you will be able to respond to these questions using the following platform. So if you go to pollev.com/dfrontier 560 on your cell phone or on your desktop, you can log in, and when the questions appear, you'll be able to respond. Now, just one item. You do not need to fill in the name field. You can log in as anonymous, and all your responses will be recorded anonymously. So let's go ahead and jump off. First of all, I'm really excited to be here with our partners at Farmacerto to look specifically at what is going to be the lasting impact of the abrupt shift to a full-blown digital engagement strategy within Brazil. And obviously this doesn't only apply for Brazil, but across our global markets. And we're going to look at this today effectively from 2 perspectives. The first one is going to be looking at the impact or the expected extension of the use of telehealth beyond the pandemic in Brazil from the perspective of the local physicians. And then second, the expectations for continued requirements from physicians for digital marketing content. So how, moving into 2021, can we stand out from the crowd within this sphere? So that said, what I want to do today, and we've been discussing this with our Ducker Frontier clients for the last 12 months or so, but I need to begin this conversation by defining specifically what is digital engagement in healthcare. As many times we see that there are diverging definitions across companies, but also within companies. So I want to make sure we're all on the same page before we start diving into these topics. So first of all, digital engagement for us is a component of the overall digital transformation for healthcare firms, which encompasses 3 buckets. First of all, processes; second, people management; and third, the stakeholder engagement. So specifically today, we're going to be looking at that 3rd bucket, digital stakeholder engagement. These 2 items are broken down into 2 components: digital solutions and digital marketing. So specifically, to begin with, I'm going to be looking at one digital solution, which is telehealth, that we know that in Brazil, like many other countries, was not effectively legalized until the pandemic. So we entered into the pandemic. There were some legal actions being taken by some major payers in the market in order to try to find legal avenues for the expansion of telehealth. But the pandemic itself has significantly expanded the operationalization of telehealth, but also provided the platform to legalize its use locally. So we want to understand, from the perspective of physicians, what are the challenges that we've seen in implementing telehealth, but also specifically what's likely to happen moving to 2021 and 2022. So in that perspective, of course, I need to highlight that telehealth only represents a component of the overall digital healthcare solution landscape. So we're doing a major zoom in here. We've identified 17 different digital healthcare solutions, and we've put these into 5 different buckets, ranging first of all from data collection, which we know during the pandemic has become critical, especially as we look at immunization, a collection of data regarding infection rates, etc., all the way to processes. So how can we augment the processes that hospitals, clinics are undertaking, either in training through 3D printing for surgeons to work to practice their techniques, to actually in-house augmentation of processes to improve effectiveness in the operating room. So what we're looking at today here is telehealth, but again, this is a broad spectrum of potential applications. So within that discussion, we effectively have 2 questions that we wanted to answer. So within telehealth, specifically looking at telemedicine, how will it evolve after the pandemic? So there's still some legal uncertainty in Brazil regarding the extension of the application of telemedicine following the pandemic. And also not only from a legal perspective, but also from a learning and investment perspective, what are the greatest barriers for the continued expansion? We're going to start here, and then we'll pass on to the second component of the digital engagement, which is digital marketing. So to answer these 2 questions specifically, what we did with our partner Farmacerto, and Fabrice will be speaking a little bit later on some of their experiences, is specifically looking at some of these issues, was to go to the market and understand from a physician perspective, what are the expectations for 2021? Because besides your payers, the HCPs are really the individuals here that are having to undergo this transformation, both from their own, the perspective of their own practices, but also from the perspective of their patients. So the first thing we wanted to understand was, how do they anticipate that the use of telemedicine in Brazil will evolve following the pandemic? We know we've had this massive increase, and it's not just Brazil, it's the United States, it's China, it's Russia, it's Western Europe. But specifically here, we want to understand, how will that evolve in 2021, 2022? And the first thing that we identified was effectively that we see 2 key indications here. The first one is more physicians actually believe, so 43% of physicians actually believe that the basic consultation, so basic patient visits via telemedicine will actually decrease following the pandemic against where we are today. So more of your primary care visits and other visits that are being realized via telemedicine today will shift back to in-person visits than the number that thought that they will actually increase at 41%. Very close, but still a bias towards shifting back to the in-person visits, and for various reasons. However, what really stood out for us was the fact that where physicians saw the greatest opportunity to actually increase the use of telemedicine was in patient follow-up. So helping patients to continue with their treatment regimes following the initial consultation in which they're diagnosed and a treatment is prescribed. So this obviously opens up major opportunities for a market such as Brazil, where we all know that one of the major cost drivers that's pushing up costs both for the private market as well as the public market is the poor integrated care delivered to patients, from primary care to secondary and tertiary care, effectively driving up cost. And if we can use a telemedicine platform to effectively realize the patient follow-up process and ensure that patient treatment regimes are being adhered to, we can drive down cost over time and shift more money into access to innovation. So within that bucket, we also wanted to know here specifically what is the biggest challenge for expanding the use of telemedicine following the pandemic for patient follow-up. And we were really expecting, to be honest, we were expecting the physicians to specifically point out the questions around reimbursement. Reimbursement is a huge issue for telemedicine around the world. We've seen some countries have to increase reimbursement for telemedicine to basic levels that we'd already seen in in-person visits to ensure that physician groups continue to provide adequate care to their populations. However, what we ended up seeing was that yes, while it was for 31% of the physicians a critical issue, what ended up being the main focus here was, in fact, the knowledge of the patients of how to use the platforms that are in existence to follow up with their physicians following the initial diagnosis and treatment prescription. Now, what's interesting here is that when we've spoken with teams in the market that are trying to support the implementation of telehealth in Brazil, the main focus, in fact, has been on helping physician groups understand what is possible and what investments they need to make. But I think so far little has been done from a patient perspective of informing the patients what platforms they can use, how they can access data, how they can get that reimbursed from their insurance, as well as how they should be following up from these digital platforms, both from a scheduling perspective, but also in terms of timing and cadence. The second question we had for the physicians here, and this is really critical because there's a lot of open questions as to the, let's say, the extent to which the legal changes that have taken place, both from a executive decree as well as a decision by the local medical association in Brazil to permit telemedicine during the pandemic, there's a question of to what extent will this be extended post-pandemic. So we really wanted to understand, not just from a patient perspective, but specifically from a physician perspective, what were their greatest concerns in actually operationalizing and continuing to expand telemedicine in the market. So here we looked at what is the greatest barrier that you confront currently with respect to the expansion of telemedicine going beyond the current pandemic. And again here, I think that we weren't actually surprised with the results in this case, given that those legal question marks that are still outstanding. We see that 45% actually said the legal uncertainty, which of course for private practices can create a huge barrier for implementing telemedicine in the short term if you have questions around legality. And what was also interesting here was the point on data protection, as of course we're generating a huge amount of new data. However, we wanted to dive a little deeper here and specifically understand what was it about the legal uncertainty that was causing issues. And what came to fruition with this question was effectively that physicians it still isn't clear for them within the context of using the different platforms available, whether those be the evolution of some of the basic platforms or some of the more, let's say, specific platforms that were designed originally for telehealth purposes, is the question around who has responsibility for digital security. And again, it's not clearly defined in either the decree or the regulation from the local medical association. And also you have, for those of you who are not aware, you have a new data protection law in Brazil that will begin to be applied at the beginning of 2021, called the General Law of Personal Data Protection. And so that is likely opening up a lot of questions about how this application can be expanded. The second item that really stood out with 31% of the respondents was knowing what can be done via telemedicine overall. And I think this is really critical because if we think about the major challenges across healthcare systems right now, it's really getting the chronically ill patients that aren't COVID-19 patients back to their treatment regimes or even getting diagnosed. And within the context of not having a vaccine until Q2, Q3, or even Q4 of 2021, it's going to be really necessary to continue to use tools that allow us to diagnose and treat patients and follow up with patients that have chronic conditions via methods that are conducive to social distancing, also aka telehealth. So if physicians aren't aware that they can expand this application to other therapy areas, go beyond just basic consultations, this is going to create a huge barrier to that recuperation. And really, this is an item that should be addressed in the short term if we want to help the market recover those elective procedures not related to COVID-19. So I want to pause here and ask our first question before moving to digital marketing specifically, and that is your company currently working on it or have a telemedicine solution for the Brazilian market? Whether you're doing this in partnership or with a third party or directly. So again, you guys can log into polev.com /dfrontier560, either on your cell phone or on your desktop, and you'll be able to answer this question. We're going to benchmark, we're going to combine these responses with the responses we received during the Portuguese version of this webinar that we conducted yesterday, in order to provide you guys with clear benchmarking around what companies are doing in terms of supporting this transformation. So are we looking at diagnosis, treatment, patient follow-up? We're still considering what is possible, or is it unlikely that we'll do anything? And again, this is a real challenge. And most companies, I don't think, have the internal capabilities, but will likely need to work with a third party in order to look for these solutions. So I'm going to leave this here for about another 10 seconds and then continue to move forward. I see we have a good number of responses so far. So it looks like we're still, for the most part, in the process of trying to understand what is possible, and that makes a lot of sense considering recent legal changes. But we also see that there absolutely is a pressing need, not only for current solutions, but also for education, and not just from the physician side of what private practices can be implementing beyond basic consultations, moving to new therapy areas, but also specifically from a patient perspective. How do we help payers and providers educate patients regarding how they're supposed to be accessing and utilizing these platforms? So now I want to spend some time, and I'm going to spend more time here, in fact, on the question of digital marketing. The digital marketing component differs for us from the digital solutions, which included telehealth, as what we're effectively doing is creating awareness of the challenges faced by the healthcare market, to creating awareness of treatment pathways, creating awareness of diseases in some instances, influencing decision making, whether that be of physicians, patients, payers, in some case public stakeholders, and then advocating for funding or possibly even policy changes. And we know right now with the upheaval that exists locally and across the globe, being part of this conversation is absolutely critical. Now, I want to first set the stage again for how we conducted this analysis. And it's very basic from the beginning, but from a strategic standpoint of digital marketing within healthcare, the first thing we have to do is decide who are the stakeholders we're targeting. So patients, physicians, administrators, procurement within hospitals. Again, here we're focusing on the physicians, which tend to be the key focus of most companies in the market when we're trying to communicate about therapies and pathologies. Then we have digital channels, so we need to choose which channels are we using. And then what content are we pushing down those channels? And then finally, we need to recalibrate this mix. So what's worked, what's not working, how can we improve and make sure we're able to better execute? So what we wanted to answer within the context of the pandemic was specifically, how has the pandemic changed behavior regarding the desire for different channels, different content? And what does this mean for how we need to recalibrate our go-to-market strategy with our digital campaigns to ensure that we're driving a differentiated message and actually driving ROI? So the first thing I wanted to highlight for you, and we're going to have a mixture here of some benchmarking between industry benchmarking and physician benchmarking in Brazil, provided by our partner Farmacerto. And what we've seen, specifically to begin with, this is looking at before the pandemic. Before the pandemic, healthcare firms operating in Brazil were effectively investing between 10 and 20% of their marketing budgets in digital marketing, which means that the balance was being invested in traditional marketing methods. Now, this obviously has faced an abrupt shift for which most companies were not 100% prepared. I don't think anyone could have been prepared for the shift in the operating environment created by the pandemic. However, we can see that even before the pandemic, we are already anticipating a shift to even more of our budgets going to digital marketing. However, all of a sudden we were put in this position, and this has created several challenges. I would highlight a couple to begin with. First, the internal talent for actually executing on this challenge. Second, getting the right insights from the stakeholders that we're targeting. And then third, all of a sudden, this has become a very crowded field. So it's even more important that we're executing strongly from an internal capability perspective, as well as collecting the right insights, since everyone is now going down the same channels. So the first thing that we need to understand when regarding this question of how much are we investing? Do we continue to increase this investment? Do we pull back in 2021? And if the answer is we continue forward, how do we ensure that we're able to differentiate? So the first thing we need to answer is, what is the likely behavioral shift of physicians in Brazil regarding their digital, their consumption of digital materials in a professional standpoint following the pandemic? So we effectively asked, do you believe that you will maintain your digital habits in your professional life after the pandemic, to our group of physicians here? And what's really standing out is that over 80% actually says they're either likely or very likely to maintain the changes in their behavior, their consumption of digital content from a professional standpoint following the pandemic, with only 18% effectively saying, I don't know. So it's really clear here that this isn't just a one-off shift, but this is a shift that will that we're not going to come back from. So the investments have been accelerated, but now it's time to figure out how do we make and sustain a differentiation with this message that we're going to market with. So on that point, the first thing that we want to see is the desire for the shift in mix between in-person and digital content. So we know that effectively the behaviors, what channels that physicians are looking at, and also what content they're looking to get is unlikely to change moving out of the pandemic. But what about their desire for that mix of in-person versus digital content? Because just because their behaviors aren't going to change doesn't mean that they don't want the in-person visits to resume at the same level as they were prior to the pandemic. So we effectively asked, do you believe the industry should adjust engagement with physicians after the pandemic in comparison, or how, excuse me, in comparison with the current situation? And what really stood out to us here was that the two largest buckets of responses, at about to 25% apiece, we saw that effectively physicians are asking to maintain the current level of inpatient engagement, which we know has plummeted significantly, with half of that group saying increase digital at the same time, the other half saying reduce digital at the same time. So really, it's hard to draw conclusions from this specific benchmarking. So what we effectively did was try to split out the groups of physicians that responded to this question, looking at those that younger group and the older group, those younger than 50 years and those older than 50 years. And we really had some items that stood out here. First of all, the older group, in fact, is the largest component of those respondents said they preferred reducing in-person engagement while maintaining the digital engagement steady, which was very interesting because, in fact, what you might have expected was that the older group of physicians would be less interested in the digital channels, given their the lower level of ease that they have in working with those channels, or lower level of knowledge of those channels. But that's a little bit of the opposite of what we're seeing here. They're in fact asking for maintaining that digital engagement while reducing the in-person engagement. While at the same time, that group of 50 years or younger are actually asking to both reduce in-person and still reduce the digital engagement. So what we're effectively seeing here, and I think that one item that stands out is that you have this younger group of physicians that, yes, have a more busier life, are still learning, and still potentially in some instances trying to raise a family at the same time that they're in this pandemic situation. But historically speaking, they've also received greater engagement from the industry, both from a digital and in-person perspective, and are likely doing so even at this moment in order to influence their decision-making process. And we can see right now that they're effectively feeling overwhelmed within the context of this pandemic. And this is going to start getting us into the next component of the conversation of, okay, if the physicians overall are saying on net, let's pull back a little bit. However, the digital engagement information we're still getting is important. What's the real question mark is, how can we get a more effective message so we're making sure that we're using the attention that we have in the best way possible. And just to highlight that we've broken down the components of this survey, and what we've effectively seen is that on net, you have more individuals in both groups suggesting a reduction in both components, both in person as well as digital, against actually increasing. So again, I think that even within the context of this pandemic, what's going to be important is not necessarily driving more content, but making sure we're driving better content and the right content to the right stakeholders, looking across the different segments. So I have one question for this group on this item before moving forward. And that's specifically, to what extent have your company's in-person physician visits recovered in Brazil to date since the beginning of the pandemic? So is it 0%, between 1 and 20%, between 20 and 50%, or more than a 50% recovery, but not fully? And again, we're going to be combining these results with the results that we have from the Portuguese version that we conducted yesterday. So I'm going to give us a few seconds here. And again, just to remind the room, these responses are totally anonymous, but a good way of benchmarking and understanding what the trends are within the industry. So what's really going to be interesting in the next component of the conversation is going to be, how can we better tailor the message that we're delivering to the physicians within the context of the pandemic and the post-pandemic, knowing that they're going to maintain a lot of their digital habits, but they're effectively asking for less engagement, both from an in-person as well as a digital perspective, but still see value in that engagement. So we're going to begin by looking now at the channel question. What channels are they effectively using? And so here we're looking at, we asked, please indicate which digital channel you have most used during the pandemic. So what really stands out here is the utilization of webinars and online seminars, 62%, followed by social media and instant text messaging. Now, what's super interesting about this is that this is, we've seen an uptick in the industry for creating webinar content. in order to engage, because we've had all of these events, in-person events, whether they be events around clinical issues or other content that the industry is trying to communicate with the physician groups, they've been canceled. So of course, most of this has been turned into webinars and online seminars. It makes total sense why this number is the highest. However, what's also interesting here is that a lot of the physicians, especially the specialists not related with COVID activities, have had more time on their hands to retake training in the interim period between the cancellation of non-COVID treatments and the restarting of those treatments, which also is a very clear reason for which we see this increase in webinars and online seminars. So I'm going to pause here before we get into what exactly the content is that they're looking through these webinars and online seminars. We're going to have to continue in this direction, but we know the biggest challenge for our clients has been actually creating this content, creating the identifying the ideas, but you also need to sustain this effort. It's not one-off. You need to maintain the attention of these individuals. So one of the last questions I'm going to have for the group today is, what is the most difficult part of delivering effective webinars or online seminars in Brazil? Is it in fact identifying the ideas for these webinars? Is it creating the content? We need to design the content, invite speakers. Many times these speakers are very busy. Is it sustaining a webinar series instead of one-off efforts? Or is there something else going on that we should actually be paying attention to? So I'm just, again, we're going to leave this for a few seconds. It's very interesting so far with the sustaining a webinar series instead of one-off efforts. This is the exact same result we had yesterday in our Portuguese version, so no surprise for us here. And again, it's an incredible amount of effort that goes into both recruiting, designing, and delivering a series of webinars, especially given the increased demand for strong content and the fact that we're seeing more and more people from the perspective of the industry go down this avenue. Now, what's also important here is what the industry was doing prior. So this was a benchmarking from the industry prior to the pandemic, and we wanted to know what channels were you actually using. The concentration was on corporate websites with basic product portfolio, not even patient support programs, but just basic product portfolio information, followed by email. So your traditional channels, basic websites and email, whereas in items such as patient support programs represented here by your corporate website designed to provide needed clinical information as well as social media, were lagging behind. Webinars were not necessarily something that we were accustomed to running prior to this pandemic, so it makes sense that we're struggling so mightily. But what's really important here is thinking about 2021. The situation is not going to abruptly change all of a sudden in Q1, and this is an investment that we're going to have to find a way to make more effective. So from a content perspective, that was from a channel perspective. From a content perspective, what we wanted to know was effectively what do the physicians feel in terms of the quality of the content, but also what do they want more of? So very simple here. We ask, which of the following do you believe to be the most important action now for companies, healthcare firms, that are creating digital content for healthcare professionals? And no surprise whatsoever, 66% said improving the relevance of the content. A follow-up here is 41% said we need to adjust the channels used to deliver that content. But overall, 66% said, hey, I'm asking you to deliver less, but I'm asking you to deliver less that's more relevant. I don't think that this comes as any surprise whatsoever, likely for the individuals on the line. We saw in our survey, and I'm not going to show it here, but in our survey prior to the pandemic with the industry, the #1 challenge that was faced was creating consistent, relevant content for physicians across emerging markets and specifically in Brazil. And it's very difficult. And again, the challenge here is that when we're all crowding into the same channels, and we know that these trends are going to be extended, and more the physicians are going to become very discerning with what they are engaging with, this is going to become a critical component of your overall strategy. So we looked here at the next question was, please select the top 3 items of greatest utility of the following digital resources that firms provide access to. So effectively, they could select the top 3 here. And in order, what we ended up seeing was that most physicians are saying the content that we want is updates on new clinical research. That's 59% selected that within their top 3 of these items, running from professional groups or discussion forums all the way to clinical information on established products. Now, what was interesting here was that number 2 selection was effectively a tie between the professional groups, the patient support information, guidelines or protocols, and clinical information on new products. So again, what we were able to do was segment this group in age brackets, and we could have done this in age brackets or geographies or specialties, but here it's simply we're looking at the different age brackets, and we are actually able to take away a couple of key learnings. First of all, those above the age of 50, both groups responded. The most responses were the updates on clinical research, but for those the age of 50, what was interesting that stood out was the requirement for a patient support information specifically, so more information to support their patients, as well as staying updated on new products. Now, against those under the age of 50, what was really interesting here is that that's where we saw the biggest delta. Those under the age of 50 are asking effectively for more support in their education and their ability to execute from a clinical perspective within their practice. So access to clinical guidelines and protocols, but also access to professional groups and discussion forums in order to improve their knowledge base within their specialty areas. So again, you're seeing a very clear difference within the segmentation of the messaging that we need to provide. We've started out by looking at both groups, older than 50 and younger than 50, clearly have different opinions on where they want your overall engagement to go from digital to in-person in terms of frequency. But also here you're beginning to see a change, a difference across these two segments in terms of channel, but also in terms of content that they're looking at. And again, these are just 2 segments. We could have broken this down into much more detail here. So I've started to get into our final subject of today's conversation, which is the segmentation of our targeted stakeholders within our digital engagement or digital marketing strategies in Brazil. So I just wanted to ask, the last question is, how satisfied are you in your team's current ability to segment the recipients of your digital marketing campaigns to drive differentiated and tailored content? Which I think we're beginning to see is the key message here, is that we're not going away from this trend of increased demands for digital content from the physicians, but they're clearly not satisfied with what they're currently receiving, and there's huge differences across segments. And we can tell that just by looking at the breakdown between this simple 2 groups of age brackets. So again, are we very satisfied or very unsatisfied or somewhere in between in terms of our ability to break down these segments? So again, we'll be combining these results with the results from our Portuguese version of this webinar that we ran yesterday. But I want to go ahead and move on and leave time for the discussion we're going to have with Fabrice, as well as Q&A at the end. So I just want to leave you guys with a few last thoughts for today. Those last thoughts are going to come from a benchmarking that we did with the industry prior to the pandemic. Specifically, we want to understand how the industry was going about in Brazil actually collecting this information. So we asked, how does your company collect information about targeted stakeholders to inform your digital marketing strategy? And interestingly here, the majority, 62%, said they were looking at some sort of focus groups. But when we begin to ask questions around, for those that responded to focus groups, what stood out was that most of these focus groups were not designed specifically to understand the trends within digital marketing, but they were designed for other purposes, with a couple of questions thrown in around what digital channels do you prefer, what digital content do you need. So these were not specifically designed in that area, and it's going to be very important as we continue to increase this investment. And then the other thing that stands out here is the 54% still using just general observation. So the question, if we're going to improve in this direction, is we need to continue to improve this information collection from the perspective of what does each of these segments need and want in order to effectively engage and drive our message. So finally, I'm going to end here looking at this benchmarking, that it was the question of, in which areas in this process do you feel the least satisfied? And what's very interesting here is that the key takeaway is that this process of information collection from your stakeholders that you're targeting is not one-off, and it's multifaceted. So we both need to be identifying how are they using the information, but also what are the gaps in the information that's being provided. And answering both these questions is going to become more and more critical. Again, as companies pile into the digital channels, the physicians become more and more discerning. They ask for less but better quality, and our message potentially gets lost within the crowded field across these channels, both for webinars as well as social media accounts, text messaging, and email. So what I want to do at this point is go ahead and invite our partner, Pharmacerto, to discuss a little bit of what they're seeing in terms of best practices from this perspective of how we can actually collect this information and better segment those customers. So Fabrici, do we have you on the line?
Yes, good morning to everybody.
Good morning. Good morning. So I'm just going to ask you a few questions here, if you don't mind speaking a little bit of your experience regarding this process, because for a lot of firms, while they've begun, they've been hit with this situation very quickly, and it's obviously a big challenge while everything else is going on. We're still having to understand the policy changes taking place, driving access through very backed up HTAs as well as your local sanitary bodies. So the first question I have is, how do you define the segmentation of physicians who will be impacted by your client's digital campaign? So what do you look at in terms of segmentation?
Great. Basically, we work with big data methodology, concentrating in a unique repository, information providing from several sources. Obviously, the Federal Council of Medicine, government data, upon all the physician in Brazil, but mainly our recurrent contact, we do every day upon thousands of physicians asking for how they do prefer to be contacted, considering also things they previously made upon our platforms, and looking for identifying the price of a consultation to better understand the level of prescription, and finally the hierarchical level, so we can understand what is in decision level of each physician in its institution, and so we can better understand who are the physicians who are making the numbers actually, and looking the entire universe, who are the physicians who have the same profile, and then we can identify better which are the good digital profile. And what is a digital profile? Mainly the physicians who are connected, who participate of social media, and obviously the one who had already opted in our different projects.
Excellent, excellent. So just summarizing a little bit here, the platform that you're using and from your experience, there are various beyond looking at age profiles, geographical location. There are numerous levels of segmentation that can be conducted to answer these questions of how should we be engaging in terms of filling information gaps, but also understanding how these different profiles of physicians are actually using the information we're delivering from a digital perspective to make decisions. And what's really going to be important here is thinking about beyond the simplistic, is thinking about the price sensitivity, interest in innovation, and other key factors that really drive some of the decision-making processes for these different physician groups. So I'm going to come back to this second question, and we have a list of 4 questions for you here. And the second one is, how do you see the evolution of the digital pharmaceutical business in Brazil? So what have been some of the key changes that you've actually seen over the past 6 months or so with the pandemic?
Great. We are clearly still in the phase 1. The engagement of the doctor is only the first step of a big move. But obviously, we need to understand better. We need to go after the patient integration, institution, payers, logistic chain, in order to track all the process who leads to the final act of the medicine cell. Right? We are including working right now on a kind of marketplace for medicine and to supply hospitals and clinic. And the final, in terms of strategy, the final goal is trying to monitor the physician by their patient, obviously in a legal base, according to the compliance rule, obviously. But the goal is to track every path of the health journey.
Mm-hmm. Perfect. So just one last question for you, and I think that you've elaborated a little bit in this last component, and I talked about it to some extent, but what do you see as the biggest challenge from a perspective of the implementation of the LGDP next year in 2021? How does that impact the firm's ability to engage from a digital perspective?
Right. Well, we think it's essential, because with no strong controls, the entire model will be at risk. And all our products were born with this concern. But to support our clients, we create opt-in platform to be fully compliant with the LGBT, and for each laboratory to have his own opt-in for each campaign you pretend to make with the physician.
Excellent. So we've got thank you for that, Fabrice, and I think that there's a lot more that we can go into, and obviously we don't have all the time in the world today, and what we want to do is open up for some Q&A. So I think Renata has some questions from the group, and Fabrice, if you don't mind staying on the line to possibly help me answer some of the questions. But Renata, I'm going to turn it over to you to go ahead and read us some of the questions that you've got.
Yes, of course. Thank you, Alec. So we do have a few questions for you, and I'll start with the first one, which is, could you elaborate a bit on the sample size and dynamics? Primary versus specialized HCPs, private versus public HCP, area of specialty, etc. That's the first one.
Mm-hmm. Fabrice, would you like to talk about the group of physicians that Farmacéutico has access to, and how we've worked across different specialty areas just for this benchmarking?
Yeah, sure. Basically, we are covering all the physician activity in Brazil, something like for 1,050 for 100,000 physicians in all the kind of market, private and public, office and hospital. And we are making basically a sense by phone with everyone to reach this kind of information, specialty, hierarchy level, if he's a director, if he's a service chief, what kind of insurance they can attend, and so on. And basically, which is the better channel to contact this physician.
Mm-hmm.
So we have a complete pictures of the whole universe in Brazil.
Yeah, excellent. And for the perspective of this benchmarking, we use this platform, but only used it for a very limited time to get a quick sample size. And I think the sample size was a little under 100, but we effectively collected information from different specialty areas in both the public and private physicians. So the samples that we see here are mixed. They represent a generic sample, not specifically looking at primary care or specialists. However, again, with the panel that is available, you can dig down and answer those questions specifically if you want to look at primary, if you want to look at ophthalmology, if you want to look at radiology, etc. That is a possibility. However, the benchmark here we're looking at is effectively represents a mix across both public and private, as well as considering different specialty areas. So I think, Renata, what other questions does the group have?
Yes, thank you, Alex. So just before I move on to the other two questions that we have here that I think we'll have time to answer today, I just wanted to make an important note as we're approaching the end. It's a reminder, actually. I wanted to tell all the participants that you will be able to access this recording, the slides that we used today, and also the polling results through our online Frontier View platform. So please contact your client services manager, contact us if you have any follow-up questions or any topics that you want to address with us, either as a follow-up related to today's session or also on a one-on-one basis. We will be more than happy to be discussing this with you. And please check frontierview.com to make sure that you can have these slides, that you can see the results from the polling and share it with your teams as well. As I brought that message, now I just want to move to the second question, which is, do you see the same trends in other countries that you're seeing in Brazil? This is a good one.
No, I think it's a good one. It's a good opportunity for learning, and I'm just going to leave this poll open. So we kindly asked to help understand what the group needs to understand more for potential follow-up webinar and potential benchmarking in the market. So we're seeing the exact same challenges. It varies between market, considering the legal some of the legal questions. So we're currently conducting a global analysis of digital health policies, specifically looking at which policies have been created from a data protection standpoint, from a telehealth standpoint, and from other key components, data analysis standpoint within the healthcare sector. And so it varies across countries, and you have different situation across countries where, in fact, you can do different things, and that creates different challenges and different barriers. So if from a legal perspective, it's very clear in Brazil what you could do from a telehealth perspective, you would not find yourself in the current situation as you do. It would have faster adoption. It would be easier for us to identify what next steps we take. And then second, I think what's really interesting is that what we're seeing with most firms, and you talked about the global perspective, is from a digital marketing standpoint, we're seeing the same trends, but from a global perspective, what we're actually seeing is that there's more innovation being undertaken in smaller markets, where in fact the risk is less from a budgeting standpoint, or either within very constrained markets in places like Brazil. So having a targeted campaign, innovating on the way you're going to market with message in a specific city or state in order to beta test that campaign and understand what the actual impact on your stakeholders is. But again, from a global perspective, we're seeing that being done, looking at smaller markets to actually take risks regarding how we're conducting some of these strategies.
Wonderful. Thank you, Alec. We do have one more question. I think we have a few minutes left. Is that okay with you?
Yeah, one more question is great.
Okay, awesome. So the last question we have is, what similarities or lessons learned do you see from other industries?
Yeah, no, it's a great question. I think it's very straightforward. I can summarize quickly. The industries where we're seeing the best from a digital marketing perspective, we're seeing the greatest success are the ones that are able to collect real-time information on how individuals are using the information that they're putting out, and those are industries specifically that have closed systems with their customers. So we're looking here at tech, where they're looking for the product information online, they're buying the product online, and then they're using software or hardware that's connected to a cloud platform. So you're literally tracking the entire customer journey. You're understanding how they're using that information. And why I think that's really interesting for healthcare is that digital marketing will evolve alongside the application of other digital health tools. As more and more of our that process from the buyer perspective, but also from the patient physician perspective, are being undertaken online, we'll be able to better understand that journey. But until that point, it's going to be critical to continue to look for that information directly from those stakeholders.
Amazing, perfect. Thank you, Alec. So I would like to take these 2 next minutes to thank you all for joining today. This was an amazing session. And I also wanted to thank our presenters, Alec, Bruno, and Fabrice. And just reiterate that we're going to be sending this recording with the slides to all of you via email. But also we're going to be publishing those, including the results from today's polls, on frontierview.com, so on our online platform. And if you want to download it, if you want to share with your teams, just access the website and it's going to be there ready for you. I think that's it. Alec, would you like to maybe conclude with some final words?
I think no. Thanks to everyone for your time. I think the message is very clear. The context has shifted, and now the question is what comes next. We've moved investments, and we have to prepare for 2021. And the physician behavior has most definitely changed, and segmentation around this messaging is going to be absolutely critical. So we'll continue to try to collect information and inform your teams about the best practices moving forward. Thank you.
Thank you, Alec. And if you have any follow-up questions, just follow up with your client services manager, and we will be more than happy to be supporting you. Thank you all. Have a great week. Bye-bye.
Thank you all. Bye-bye.